Everyone, and welcome to our session here. I'm joined because you saw the LinkedIn post or somebody shared it with you about the latest messages from NHSE about the DDAP professionals within our workforce becoming members of professional membership bodies and aiming for professional registration. So do you want to start the slides, Coraline, and then
Yep.
we've got our names on there?
Yep.
Thank you.
Can you see it?
Yeah. Back to the first one with our names so we can introduce.
Sorry.
Yeah, that's all right. Yeah. Okay, so welcome to our session about discovering your professional home for all you health and care data and analytics professionals out there. So I am Jane Johnston. I am co-CEO of AphA, and I am a leading professionally registered leading practitioner. My background, apart from the AphA hat that I wear as co-CEO, my background, I've been in the NHS 30 years working in data and analytics, and latterly working a lot on strategic commissioning, population health management, etc. So very, it's been my background all the way back to day one in the NHS. And I will just allow Coraline to introduce herself, and then we'll get on with the slides.
Thank you. Hello, I'm Coraline Bromley, and I am registered as an advanced practitioner. I am currently the Executive Director of Continued Professional Development for AphA, and in my sort of day job, I am a data governance metadata lead for the NHS Business Services Authority, where I've worked for about 4 years. Before that, I taught high school physics, so relatively new to healthcare data and analytics, but loving it so far. Right.
Great, thank
Here we
you. Right, so the purpose of AphA, we're not going to read every slide verbatim, but really key, I think, that you understand what the purpose of AphA is. We are there to raise the profile of and to represent the voice of health and care data and analytics professionals. We want to be recognised as respected industry expert, as subject matter experts in our own field, so we can provide a professional framework and a support network for our community, but also so we can work with national bodies as those subject matter experts to give voice to the direction that they take, just to make sure that they are listening to the correct people when they make decisions. One example being that everybody talks about FedIP, Federated Data Platform. That was procured using digital and leads, not really bringing in people that would be using it. So there was a lot of anomalies and issues when that came forward. We now, as AphA, have regular meetings. We did with Ming Tang, now with AphA, who stepped in her place. And we have AphA members within the central team, like the steering groups for developing some of the models on FedIP, on FDP. So we're really about getting ourselves in there to try and improve things that hit the system that we all then have to work with. So that's one of our aims. Next slide, please.
Yep.
So the journey of AphA, we actually started in the Southwest back in 2012. It was a group of analysts that worked in the provider organisations and their Southwest Regional Health Authority. And we felt that there was no place for us as analysts. I'm just going to close my door. Noise out there. There was no place for us as analysts to really get together. We had no support mechanisms. We had nobody to help us develop our careers. We were kind of an unknown entity with no support. So we started ourselves there. Now, we did start off as the Association of Professional Healthcare Analysts, but we have over time grown to support not just analysts, but any data and analytics professionals. So data scientists, warehouse developers, analysts, data engineers, all sorts of different, anyone in the data and analytics disciplines. We had our first conference in Taunton, and then we were actually funded by the Southwest Regional Health Authority. They were quite committed to establish this. Then we got our first committee going. I've been there since day one. We became a community interest company in 2016. Then we developed a new board structure and constitution in 2020. And last year, so I've been in post as a co-CEO with Emma Wright, who's based up in the Northwest, for 18 months now. And we developed our first strategy, and we've been working with our president, Sonia Patel, on developing our business strategies as well. Next slide, please. So background, I have kind of, mentioned anyway about how we developed, what we're all about. So we are a professional membership organisation, and we support career progression and professional development. We are a collective voice for our community, and we are now nationally recognised as being the go-to body for access for subject matter expertise. So we are very often brought in, contacted, as I say, by the centre for and guidance. So benefits of membership and more detail, but it's all about informed about what's happening within our community. We cover all 4 nations. We have mentorship programs, content and training options, networking and events. There's an annual conference. Our next annual conference is the 5th of November in Birmingham. It's free to members, and it's all about helping you boost your career, getting you recognition in your profession. We have a number of special interest networks, and of course, a professional registration. There's a comment there: the best investment you can make is in yourself. Now, the significance of a cup of coffee there, Costa, is it's actually £37 a year. £7 a year for higher bands. So I think it's 37 up to band 6, and band 7 and above is £47 a year. So membership is less than the cost of 1 Costa a month. So if you give up 1 cup of coffee a month, you've invested so much in yourself. And the QR code there, we will share the slides out, is so you can register. Next slide, please. So changing NHS landscape, there's an increased demand across all services with all these shifts we have towards prevention, moving health into the community, population health management, looking at achieving value-based health, commissioning aims that we are now looking at. So data is very much being used now to drive decisions across ICSs, across ICBs. There's a huge growing importance of data in decision making, and we just like to acknowledge really the pressure that all our community are under. And so all these changes are having quite an impact on our working lives, because data and analytics now, as it says at the bottom, is information, and we need organisations and the centre to understand that you need the workforce to provide that data and analytics. So next slide, please. So why does it matter more than ever? I've kind of covered that. It's no longer a back office function. We're talking frontline working here. Our roles are central to clinical decision making, to service design, and system transformation. So we need to be able to provide the insights and intelligence to inform clinical decisions on interventions they might put in using population health management lenses and approaches. We're also having to consider the reduction in inequalities and all of this to support service redesign in our transformation journey. So that's why AphA is here, and that's where we fit. We are there to support professionals such as yourselves to grow, evolve, and get the support you need to develop. So we are that professional body for health and data analytics professionals. There are other professional membership organisations out there. You have BCS, but that's quite generic in the IT field. The reason we feel that AphA is the appropriate body for all of you is because health and care, it should say health and care data and analytics is, you know, what we focus on. We're not generic, we're actually focusing in on that. So everything we do, everything we deliver is helping to support with that. We support individuals, teams and organisations where we can, and aligning also with that NHS direction. Are we having problems with me breaking up? I've just seen something come up in the chat.
Yeah, every once in a while it kind of breaks out and then comes back
Yes,
intermittently.
that this was happening to me yesterday, so I think it must be me. I'll do one more slide then, if we just go on to the next slide. So this is the NHS direction. This is the announcement that went out. Now, I did have a meeting with AphA this morning, and this table where it says the expectation for senior DDAT leaders in NHS organisations 8D and above to become a member professionally registered. If your role is a senior DDAT leader, that you're an 8B or an 8C or an 8A, unfortunately, that expectation still stands regardless of what your band is. So it's senior leaders. Now, he did say that actually the expectation is for professional registration by everybody by March 2031, not just members. So the table that they published is slightly wrong. It should say and professionally registered. As he pointed out, we would not expect a band 5 nurse not to be registered and only the band 8s and above. We expect all our nurses registered. And the thing is, with this, if you consider us as an analogy, our nursing colleagues have the RCN is like their professional membership body, but they have to be registered with the NMC. So AphA is kind of our professional membership body, but the registration goes through FedIP, and Coraline will explain that in more detail. And if I hand over to you, because
That's good.
got a better connection.
Hopefully. Yes, hopefully everyone can hear me okay. So I'm going to walk you through the benefits of AphA and kind of hopefully get you interested in kind of choosing AphA as your professional home. So I'm going to focus on 4 key areas, and the first really is just around professional identity. So as a data and analytics professional within health and care, it can often feel isolating. Maybe you're working in multiple different roles, doing a lot of different kinds of tasks, and there's not as of yet been any kind of formal recognition of being an analyst as a profession, as a professional. So within AphA, that's something that we're really focused on, making sure that you have that kind of professional identity, that professional home, you have that shared identity across disciplines that are aligned with national standards and expectations. And so it kind of just gives you that recognition and that sense that you are working in a legitimate profession. So not just that you are a data person, but that you are part of that recognized profession of being a data and analytics professional. So within our community, we have national and regional branches. So like Jane said, we cover all 4 nations. So we have a branch within Wales, we have one in Scotland, we have several across England, and we've recently relaunched a branch in Northern Ireland. So no matter where you're at, there is a local community for you, and they do a lot of, some of them do local meetups, and they do webinars around issues that might relate to that locality, or just getting people together to have conversations. So those regional networks are a really great way to build relationships. We also have specialist networks. So we have the, let's see, Women in Health Data and Analytics one. We have Health Economics. We have PHM. We have a research one that started recently. We have the CDAON network. So there's 7, I think, right now, specialist networks that we have available for you to join. Within those, they have their own magazines, they do their own webinars, and they're starting to have some in-person events as well. So there's definitely a lot to get involved in. And then we also have peer support across different organizations. So we do a mentoring program that you can get involved in, and a lot of other opportunities like that. Benefit 3 is skills and career development. So we are strong supporters of the National Competency Framework. All of the stuff within our professional registration aligns to areas of the competency framework. We offer training and events. So we have, I think Jane mentioned, the conference that's coming up in November. We also do a series of lunch and learns that are on every other Tuesday during lunch, and those cover a wide variety of different topics. Sometimes it's related to statistics, sometimes it's leadership development, sometimes it's AI. So we try and cover a wide variety of different skills that people are looking to learn, so that people can grow and develop their careers. We have mentorship opportunities. So once a year, we go through kind of a cohort of mentors. So if you're looking to perhaps build on a particular skill that you're not very comfortable with, or you're not sure what's next for you career-wise and you want to move up into something else, we have a form you can fill out with some information, and then we'll try and match you with somebody that can help you through that particular area. And we are also always looking for mentors as well. So if there's anybody that would be interested in being a mentor, there's opportunities to get involved. And once you become a member, we do have a knowledge hub on the website. This is really awesome because it's got all of the past lunch and learns on there. So you can go back and watch as many as you want. It's got the webinars from some of the networks, like the CDAON network. It's got articles, all the past magazines. So there's a really nice resource of information that you can go back and look through at your leisure. And then lastly, everything that we've talked about ties back into patient outcomes. Better data leads to better decisions, better insights leads to better targeting, and better analytics leads to reduced inequalities. So all of this really is about increasing those patient benefits. So not just thinking about data for data's sake, but everything that we're doing is about better care for patients. So what is our role in professional registration? So you do get professionally registered through FedIP, which is the Federation for Informatics Professionals. It is recognized standards across UK health informatics. It's the equivalent really of a chartered status for data and analytics professionals. So things like the RCN for nurses. And we do offer a lot of guidance and support. So if you submit your professional registration, it doesn't just kind of go into a black hole and you get an acceptance or a denial. It is a very supportive process. You have someone that is working with you as an assessor. They will come back with questions. They will try and help you fill any gaps of things that you're missing, because the goal really is that everybody becomes professionally registered, and we want you to be successful. So the assessors will do everything that they can to support you through that, to make sure that your application is successful. So don't feel like you have to do any of it alone. We are always walking that journey with you and helping where we can. And we've worked really hard to make sure that the process is achievable, and that we have a lot of resources and stuff available to help you, so that kind of reduces some of that fear and complexity around it, so that it feels like it's something you can achieve. So why should you become professionally registered? I think when I did mine, one of the big selling points for me to get my professional registration was to be able to demonstrate those skills and competencies. So I had something to be able to say that, yes, I did know what I was talking about and the work that I'm producing was to a certain quality and that I was following ethical standards, and that it gave me not only that confidence that I did know my profession, but also that hopefully other people saw that as well, and they were more likely to um, sort of have that credibility in the conversations that I was having. So a lot of reasons to get involved: career progression, mobility across organizations. If you want to move to somewhere else, we are seeing more and more job descriptions that do ask for professional registration. And so it's something that can kind of help you stand out in those application processes. Assurance of capabilities, all of that stuff is really important. So it's a balance really of personal and organizational benefits. And one of the big things I think is that personal credibility and that confidence that organizations can have in the work that you do. So what do you need to do if you want to become professionally registered with AphA? There's 3 pieces. There's an application form, and you need a minimum of 3 reflective practices, and then you have to provide some evidence. And while this can seem a bit daunting, we will go through a little bit about these to kind of give it a bit more clarity. But yeah, it's not hopefully as bad as you feel as you start. So there's 4 different levels you can choose from. You can do practitioner, senior practitioner, advanced practitioner, and leading practitioner. And we do also have 2 others, don't we, Jane, that you can do if you're not quite sure where you sit? There's like an
That
associate practitioner,
it's an affiliate member for people
affiliate.
that are joining up, maybe don't have the background. They don't have to go through the whole process, though. It's just a few words, well, a few words, 250 words or something,
Okay.
say that you commit to doing it in the future.
So that is, if you're really not sure, maybe you've just started into healthcare analytics and you don't have enough of the evidence to feel like you go into one of these 4 areas, you do have that affiliate option, which allows you to get onto the register, and then you just make that commitment that you will go up to another level when you have the pieces that you need. So this gives you a little bit more detail about kind of the skills that you have to be able to show within your evidence. So the things you need to be able to demonstrate that you're doing within your role between your reflective practice and your evidence. All of this is on the website with some really good examples as well of what kind of matches each of these. And there's examples of the reflective practices and examples of evidence and all of that to kind of help guide you through it. When it comes to the reflective practice, we do use the STAR model. So basically, you're going to start with your situation, your tasks, your actions, and then your results. And just want to say here on this slide that the process for getting registered really is more about your journey and less about the result. So we really do want to know what you did, why you did it, what decisions you made. So even if it's not a piece of work that felt like it was a 100% success, there's a lot of things that you've learned from that, and that really demonstrates a lot of these things that we're looking for. So by kind of going through it in this STAR manner, it allows you to really lay out what you achieved, what you tried, what worked. There's also a reflective piece at the end of this where it kind of asks you what went well, what didn't go well, what would you have done differently. And so all of those pieces kind of play in to matching each one of those areas. And if you look on the left, you can see those core professional standards. So you do need to make sure that all of your reflective practices map to one of those core professional standards. And so usually among 3, you can cover that, but you can provide more reflective practices if you need to, but you do need, again, a minimum of 3 to cover all of those areas. And how long does it take? And some other advice if you're thinking about doing it. People that have gone through the process before have recommended dedicating a weekend, annual leave, or evenings. I know for me, I did it, I think, over about 2 months, just in the evenings. So just a little bit of time in the evening while I after I got the kids to bed, just kind of sat down and did it in little chunks because that was easier for me to manage. Some people need to just sit down and just do it in one day and get it done. So whatever kind of works best for you. But you want to approach your reflective practices by kind of thinking of chunky pieces of work that you've done. So sitting down and just kind of writing out all the work that you've done and kind of laying out what pieces would go with each of those areas. Make sure that you include additional reflective practices if you're missing any standards in those works, and treat it as if you're telling a story. So walk through your thinking. I did this, I made that decision, that didn't work, I changed this, because again, it's more about the process that you go through than, the dashboard that you produced or anything like that. So a couple of things, if you've moved jobs, you can use past examples, but you do need to evidence it. There's no hard time limit, but to ensure that your CPD is evident, your examples should be recent. I think we ask for them to be within 2 years. Correct me if I'm wrong, Jane. Is it 2 years for your examples and your evidence? Or 3?
Yes, but two really. But if, for example, you're doing a leading practitioner and you do a 5-year business plan, then we make allowances that you're not going to do that every 3 years. But
Yeah.
on the whole, yeah.
Okay. So make sure you evidence the standards, not just the reflective practice points, and that your registration, not your, this is your registration, not your current job. So it's based off the fact that where you think you're at. So even if you're just in an analyst position and you could be doing work that meets those senior level expectations. So don't feel like you're sort of stuck in one area or the other based off of what your job role is or what your job description is. It's about what you can prove and what you can evidence that you've done. And so pick the level really that best suits you. If you end up picking one and it's not the right one, again, the assessors are there to support you. So they will have that conversation with you and either say, hey, you have a lot here, you could go for a higher level, or we're missing these pieces. Can you evidence that? If you can't, maybe go for a lower one. But we do want to get you professionally registered. So we will do our absolute best to make sure that you're at the right level so that that is successful. And if you're interested in getting professionally registered, we do have some sessions coming up that are open to members. So we have our quarterly opportunities to register are April, July, October, and January. So July is very quickly approaching, which means that we will have an introduction workshop coming up on the 16th of June. These always happen 1 month before those windows. So there'll be another one in September and another one in December. And this is similar to what we've talked about here, but it'll go into significantly more detail about the process. And then 2 weeks before the window closes, so that'll be July 9th, there's a Q&A workshop. And these are meant to kind of go into more of the nitty-gritty details of your application. So if there's something that you're stuck on, it's an opportunity to ask questions to figure out any of those missing pieces so that you can get everything submitted. And then the process will repeat again at the next window. So if this is something that you're interested in, would strongly recommend getting those memberships in so that you can attend these workshops. I think Lizzie's put them in the chat. You can sign up for the workshops. You would just need to be a member before you actually attend. This is a little bit more information on the standards. I'm not going to talk through these. You will get these slides after when we share it, so you can read them in more detail if you'd like. But just to point out what the different areas are, it gives you some nice guidance on the things you need to be able to talk about. Remember, it's again about the process. So what problems did you try and solve? How did you solve them? What were the results of your actions? So always keep thinking about the STAR model as you're going through. And there's a couple at the end around continued professional development. So these are things that aren't necessarily pieces of work, but it could be going to conferences. It could be in things that you've achieved that you have your CPD certificates for. 8 is about demonstrating professionalism. So you do need to read the AphA Code of Conduct and make sure that you're describing how your work has demonstrated you've been compliant with the Code of Conduct. working collaboratively, communication. So lots of things that you can show when you're evidencing these. Keep in mind that there's a lot of different ways you can do that. So you can have screenshots of work that you've done. You can have email chains. You can have a lot of variety. You know, maybe you've written up, like Jane said, a business report or something. So there's a wide range of things you can use as evidence. So don't feel like you have to just, you know, send in specific examples. There's a lot of ways you can show that you've worked collaboratively or communicated with others and things like that. And then lastly is the contextual standards. So these are more about, since we are the professional body for healthcare data and analytics, it's more about that piece. So you do need to be able to show that your work has had an impact on healthcare, that you do have an awareness of the healthcare sector and what it means, that you're aware of the terminology, healthcare informatics, information governance, that all of the work you do is in compliance with GDPR, all of that stuff. So there's some additional pieces that you need to cover around the healthcare side of things as well. And then that will get you through. So to sum up what we've covered today, data and analytics is central to NHS transformation. AphA exists to support you in your role and to help you be able to be more confident in what you're doing as a professional. And all of this is about value and impact for patient care. So if you want better data and better insights, then we have to make sure that we're investing in your people if you're someone that is considering this for your team, and also in yourselves if you're someone that's here to get yourself onto the register and get yourself into a professional body. And AphA will support you as much as we can in doing that. So I will leave it there and put this up for questions if anybody has any.
It's just, oh, I don't know. There's a question from Sean. So there's two things to this. Membership of AphA, we are just a membership organization supporting anybody in the data and analytics care, whether it's secondary care, primary care, community care. And we have members actually from commercial organizations that deal with health and care data. So you don't even have to be an NHS. Just if you have in health and care, data and analytics, we are a membership organisation to support you in development and career progression. Then there is the professional registration. The professional registration has different levels, affiliate being one of them. Membership is just membership. There is no levels of membership. You're a member of AphA or you're not. When you become professionally registered, you have to be a member of a professional membership body to start with, such as AphA. That is your route into professional membership through the FedIP umbrella. FedIP have a number of other professional membership bodies, such as BCS, Chime, SOCTIM, IRIM, etc. So you can't just become professionally registered with FedIP without being a member of a membership body. So the first step is get your membership with AphA. That's 37 or 47 pounds a year, and you get all the benefits. Then you look to becoming professionally registered at whatever level, depending on your skill set, your competencies, where you are in your career journey. Once you are professionally registered, you will be registered for 3 years and you will go onto a public register under FedIP. And on that register, it will have your name, your level of registration, and which professional body you are with, which will be AphA in this instance. You then have to pay an annual registration fee, which is no different from anybody else working in health and care, whether it's clinical, finance, HR, do the same. We're lucky that for us actually it's about the cheapest out of all the different professions. FedIP registration is £36 a year for lower bands, £50 a year for higher bands. So if you're a higher band analyst or higher band data and analytics professional, you have to pay £47 a year for your AphA membership and £50 a year for your FedIP registration. So £97 a year maximum to be part of a membership organisation with all the benefits that that gives you, and to hold your professional registration. You have to maintain your membership and your registration concurrently. So if your membership lapses with AphA, your Fed IP registration lapses. But if your Fed IP registration lapses, your membership carries on. But there's no statutory, requirements with regard to membership. So I hope that makes it a bit clearer, or have I just confused everyone?
Yeah, I think it did, Jane. Thanks. She just said it
So
cut out a little bit.
AphA
So
membership,
yeah,
yeah.
which I feel like is basically what you said, that you have to have the AphA membership or membership of any other professional body to be able to get professionally registered through Fed IP. So that's your first step, and then you can work toward your professional registration after that.
Any other questions, which I'll let Coraline answer because I keep cutting out? Oh, somebody else mentioned about if you're already registered, some of you might be already have professional registration, say through BCS. That's fine. That will meet the NHS requirement. You are professionally registered and you are part of a membership organisation. But if you don't already have registration, then AphA is likely the best fit for you, the best membership body to be affiliated with, to then go through your registration process.
Awesome. I do see one hand up. I can only see FH if you want to go.
AphA membership, yeah, so I'm just looking at sorry, I'll let you do the hands up in a minute.
Okay.
Can AphA membership help with finding a data job? More and more job descriptions, when they go out, are putting in the desirable and the essential professional registration. So absolutely, yes, it could put you ahead of the field in ticking those boxes for essentials and desirables on a job application. And that's membership as well, not just the registration, because it shows that you are committed to professional development and progression, and you have that wider networking understanding of the whole healthcare community.
And just to add to that, we do also have the mentorship program. So you can, have an opportunity to potentially work with somebody that is already working in health and care in some sort of role that you're interested in and could maybe help you with whatever skill gaps you might have to achieving the roles that you're looking for. So that's available as well.
Okay, so Hansa, do you want to ask your?
Sorry.
Yeah, thank you so much. I was going to ask a question about the membership, the mentorship, because I've registered to be a member of AphA. I got to know about AphA through a training I went for. It was a recommendation because I am new into data analytics as a registered nurse. I just have interest in using data. So I attended a training and the trainee suggested I register with AphA, which I did. However, because I'm very new into this data thing and I've been doing some little projects on the side on my own, I applied to be a mentee for about 2 months now and haven't got a reply. So I would like to know how long it takes for the mentorship from Berefoot.
Yeah, so we only do mentorship once a year, and so we have sort of an annual cohort, and it always starts in January. So if you did the form 2 months ago, then someone will reach out closer to January time with the next cohort starts, because this cohort has already started. So it might not be until December time, between December and February, that someone will get in touch.
But it's a good point that you've applied and it's gone into a big black hole and you haven't got a clue what's going on. So we'll pick that up and take it back. I actually have a meeting with our mentorship coordinators in a couple of weeks, So I will mention that as something to be addressed, that you're contacted and kept in the loop so you know what's going on.
Thank you.
Anything else? Anyone else? Or are you all hoping to pop off for an early lunch?
Right.
Oh,
I think there's a hand.
yeah, yeah.
Hello there. It's just a quick one. So DDAT, as per my understanding, I'm assuming we're just using the government digital services definition and the job families that sit within that, and that there isn't something that has been created within the NHS or elsewhere that may vary on that. The reason I'm asking is you have I imagine quite a lot of people on this call will be in analytics or engineering or data governance or something like that. There are other supporting roles that potentially fall outside of those families. So I'm just trying to work out at the minute, sort of in terms of the NHS's direction, what the guardrails are at the moment and what might sit outside of that.
The DDAT's kind of used as a framework, that as a starting framework, but it's not hard and fast that you know we have to fit within every definition. When the National Competency Framework was developed, it was developed for analysts to start with, and they put out surveys around the DDAT family. The competency framework has now expanded to cover all those external roles: data ethicists, data scientists, engineers, software developers, all sorts of different roles within data and analytics. So there's not like a hard and fast rule that of where you have to sit, but everything kind of works together. We use it as a framework, as a bit of a guidance on how we build the frameworks, the competency frameworks, and how we develop the standards. But we try to make them in such a way that, because if you look at the different standards and if you look at the slides, you would have seen some had SP, some had P. That's just whether you're a senior practitioner level or a practitioner level. The actual requirement of what methods did you apply, how did you approach this, organizational skills, communication, collaboration. The questions are exactly the same for every level, for every member of the data and analytics profession. It's your personal content and take on it that comes in and works towards how you put yourself through on the registration. I don't know if I've answered that for you. So there'll be more guidance in the workforce plan when it's eventually released, as I say, hopefully end of June. We don't know yet what will happen with regard to the mandation. There's two things: there's mandation, there's making it statutory, there's requirements, quite distinct in their definitions. So we don't actually know yet where that takes us, but I think hopefully the workforce plan will give us a little bit more about how this will be policed and how it will be used. But obviously there's a few years yet for some of the lower bands to get there, but it will eventually become, it will be on all job descriptions as an essential. And I suppose it would be down to the organisations how they tackle those requirements when they are shortlisting and interviewing and employing.
No, thanks. I think that's really good. A really good answer to that, because, like you say, until there's actually a plan, I know that what you can find online, for example, about this at the moment is quite high level press releases, and there's nothing really out there that says what the legal mandates are or definitions or anything else. So no, well, I suppose we'll wait for July, but thanks for that.
And also the comment that's by Matthew, you had years of experience as an analyst in other sectors. How are we trying not to lose applicants from outside the NHS? A lot of those people might already be organized, members of registered with like BCS. A lot of people from outside of the NHS are already, so you would be coming into the NHS with evidence that it's in your makeup, that's what you want to do. You're already a member of a professional body, you've already registered, not necessarily with a healthcare related organization like AphA, but you're showing that it's still the route you want to take. You still want to invest in yourself in that way. So yes, it's still a tick in the box there. Anyone else? It looks like we've run out of questions and comments in the chat. So we will be recording these sessions, or the session has been recorded, and it will be available through the AphA website. The chat there has all the different links for mentorship, for professional registration, for joining up as an AphA member. And I think with the professional registration workshops, you can actually join in the workshop, but you can't go through the professional registration process itself until you are a member. Our Lizzie, our management person who's there hovering in the background, can the non-members join the professional registration workshops, Lizzie? Yes, via the link. So you can do the professional registration workshop, but you can't go through the process until you have joined AphA, because you won't be able to get into the membership section where you go through the process to sign up through the registration process, and the workshop will just give you a lot more detail and talk you through a reflective practice example, and it will show you examples of evidence, and it will tell you about time commitment, etc.
Yeah, put those dates up again just in case people didn't see. So next one is 16th of June, if anybody is interested in going into a bit more detail about it.
Yeah, so we do two. The one on the 16th of June is for people coming in from scratch that haven't got a clue how to start. The Q&A workshop is for those people that have gone through, they started their application, they filled it all out, but maybe they just have a little couple of questions about, have they done this right? Have they done that right? Is this evidence what's needed, etc. So that's really for somebody who has started the process. So there's no, the one for newbies into the registration process is the one on the 16th of June. And submissions are taken every quarter. And once you're registered, we also are always looking for volunteers to become assessors themselves. So, something else there. If you're a member and you're registered, you can, look to become an assessor. I think that's it then, is it, everyone? We're done?
Looks like it.
Mm-hmm.
Oh,
Right.
right.
Thank you all for coming, and hopefully see you in a workshop sometime soon.
Yes, hopefully.
Or our
Thanks,
annual
everybody.
conference if you become a member.
Yes.
Okay, thank you.
Thank you very
Bye,
much.
everybody.